Hey, let's bring in now the director for the Center for Infectious Disease Research and Policy and professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. Michael, thank you so much for being with us. Doctor, I guess I should say. Doctor, thank you so much for being with us. So we had this discussion about a month or two ago. You basically told us we need to grow up. That, yes, we're going to have to reopen the economy. And yes, we're going to have spikes when we reopen the economy. We just had breaking news 5 minutes ago that retail sales jumped 18% because the economy is reopened. At the same time, of course, we're seeing a spike across the country. Tell us how we should be looking at that.
Well, actually, believe it or not, it's actually much more complicated than that. I wish it were that simple. Right now, we have 21 states where the number of cases are going up and quite dramatically, and you've already discussed that earlier in the show. It's not just the testing's going up, but the number of positive tests are actually going up. We're looking at hospitals right now that are literally on the brim of overflowing with intensive care patients. And in 21 states, we have cases decreasing. We don't understand exactly what's happening. The same reopenings occurred. The same situation in terms of potential transmission has occurred. And I think this is one of those moments of humility as humans. What this virus is doing and why it's doing it, we're just not sure. Now, we know that being in large groups and being close together indoors is surely going to put you at risk. But why some states are decreasing and others are increasing, we've got to understand that.
What about the protests that you've seen over the past several weeks? How much of a concern have you had for that? How concerned are you about the president talking about doing a rally in Tulsa?
Well, I think you have to split these off into two separate areas, indoors and outdoors. Let me cover the outdoor first. That was the one that surely we all saw on our TV screens for days on end here in this country. In that particular situation 2 weeks ago, I said, I don't know if it's going to increase cases or not because, number one, once you're outside, the virus tends to dissipate much more quickly into the air. You're not in that cloud of virus that's around someone when the air is moving. But on the other hand, you had people who were exposed to tear gas. You had people who were exposed to smoke, were coughing, which are themselves aerosolizing events, getting the virus out. We had people that were arrested, put into holding vehicles for several hours at a time, then transported to jails, processed, all indoors. But I can tell you, as of this morning, we still have not had any clear evidence of any big increase in cases almost 2 weeks out. I would say if we go another week, we probably aren't going to see a lot of impact from the protests if we don't see a change in cases. As far as indoors, I mean, it doesn't matter whether it's a political rally, whether it's a rock concert, whether it's anything. If you're indoors with lots of people, there the air does concentrate the virus. It's around you. It doesn't go away. And that's what we have to understand. You put yourself into harm's way like that, it's a problem. I summarize it simply by saying I wouldn't want my loved ones in those kinds of settings.
Dr. Osterholm, it's Willie Geist. Good to see you this morning. You've said that this virus will not rest. In other words, it will continue to spread until it reaches 60 to 70% of the population. That's going to pop a lot of eyes that hear you say that. What do you mean specifically by that number?
Well, you know, Willie, it's interesting because I've been saying this for months, and as have a number of my colleagues. And the fact that Americans still don't get it, as you said, I think you're right. Probably pops your eyes when they hear this. What we don't have is the battle mindset that we need to take this virus on. We keep thinking if we just get over the next week or the next month, if we just get things reopened up again, everything's going to be okay. I can tell you right now that's not the situation. For us, when you think about all the pain and suffering, death, and economic disruption that's occurred with 5% of this population having been infected, think what it's going to take to get us to 60 or 70%, where then there'll be enough people who have been infected and hopefully have immunity that it slows down the transmission in the community. This is going to go on for a long time. This is not an overnight event. We're in this thing for months. And Americans and the world has to understand that that's what we have to prepare for. Economic news today is great. I'm glad to hear about retail sales. But what happens if we see big spikes, big waves of cases that are going to come down the road in the months ahead? How prepared are we for that, psychologically or from the standpoint of our hospitals? So I think your point's a really important one in terms of eye-popping, but it shouldn't be anymore.
Yeah, and of course, there are also stories this morning about restaurants across America opening up and then having to close down a week or two later as they try to handle some infections either on their staff or from people that came to the restaurants. Dr. Michael Osterholm, we love having you on. We have a shorter window today. Unfortunately, I'm told we go to bars in about 30 seconds, so we're going to have to let you go.
Thank you.
I hope you will come back very soon.
Thank you
Coming
very
up
much.
next.
Have a good day.
All right. Thank you. You too, Doctor. Coming up next, 10 years ago, Barack Obama didn't support same-sex marriage. This year, you had Mayor Pete storming the national stage. We're going to talk about the fast pace of change in the gay community, including yesterday's historic Supreme Court ruling when Morning Joe returns. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.